We've had the Code Blue program in Ogden City for the last 2 years.
It's a program Kenny Miller, a battalion chief with the Ogden City Fire Department who oversees emergency management, says they modeled after a similar one in New Jersey.
When Code Blue goes into effect, it allows the shelter to use their overflow section and use it as a primary bedding area for individuals.
He says they have 2 shelters in Ogden, the primary one being the Lantern House. Under Code Blue, he says the shelter's normal capacity can increase 35%.
The Lantern House does suspend some of their rules for certain individuals that may or may not be allowed in the Lantern House during normal operating business time.
While Ogden had their own Code Blue criteria the last few years, Miller says that's now been taken over by the state. Legislation passed here in Utah earlier this year requiring larger counties to keep people warm when temperatures drop below 15 degrees.
That is more than 2 hours in a 24 to 48 hour period.
According to the Utah Department of Health and Human Services, a homeless shelter cannot deny temporary shelter to anyone experiencing homelessness who requests access to the shelter unless they're at capacity limit or if the individual presents a danger to the homeless shelter's staff or guests.
It lays out for counties of the first, second, third, and fourth class responsibilities, regulations regarding Code Blue. There's only one first-class county in the state, that's Salt Lake County.
Wayne Niederhauser, the homeless coordinator for the state of Utah, worked closely on the legislation that was passed earlier this year. He described how the process works.
The Weather Service is monitored by the Department of Health and Human Services, and when they determine, according to statute, that there's a Code Blue event, they issue the Code Blue. That goes out to the counties, and then it's their responsibility to respond.
In Salt Lake County throughout the winter this year, his office says there will be a total of 600 plus winter response beds available and an additional 200 beds for Code Blue. It's a tool both Niederhauser and Miller say can ultimately save lives.
People experience frostbite, some pretty extreme harm, and even death if they don't get into a safe place.
Bottom line is we need to try to keep everybody safe.
In Ogden, Chris Arnold, Fox 13 News, Utah.